to the aging. So thank them for allowing this to happen and collaborating with Penn State University, and Penn State University, of course, for having this be available. So I wanted to just go over a little bit of what our agenda is going to look like over the next two-part series here. But before that, we wanted to do something a little bit. We're just curious here of what your name is and where you're from and what interested you in joining this webinar this evening. So if you feel comfortable doing that, you can go ahead and put that information in the chat box for us. And I'm just going to go over our four-part series and what those topics are. And then I'm going to hand off the mic to Nancy, and I'll rejoin you guys next week for part 2 of our two-part series. So let's go into what are we going to talk about today. So today is going to be pretty exciting. We're going to talk about part 1 is what is aging life care. Nancy will be presenting on that next. And then part 2 will be the domains of knowledge or the areas of competency for the aging life care professional. And so again, I'm very honored and privileged to be here amongst my colleagues and my distinguished aging life care professionals, Nancy and Shauna. And don't forget to join us for part 3, where we'll discuss opportunities and how to get started in part 4. And that will be next week, the same time on Tuesday, September 20th at 6 p.m. Eastern. So anyway, with all that now, thank you, and I'll hand it over to Nancy.
Thank you, Jennifer. I hope everybody can hear me. I'll be discussing, what is life care management. Before I get into that, and I have to move all the pretty gallery of people so I can see my slides. Before I get into this and talk about what are aging life care professionals, I'll give you a little background about myself. I've been in this industry for about a little over 20 years, and I too attended a similar kind of career-oriented discussion group. Mine was more focused on gerontology, but it offered kind of similar information. And in fact, leading into my postmaster's in gerontology, I found aging life care managers. Back then, we were called geriatric care managers in my courses. And that got me into this profession. I moved from research into clinical, became a medical social worker, and then moved slowly into my own practice. My practice is based in Manhattan, and I have primarily a group practice in aging life care management. And I come at it from the social work perspective, but as you'll see, this field really has a lot of opportunities for many credentialed individuals. So I will begin. What are aging life care professionals? So you're going to see typically nurses, social workers, gerontologists, counselors. People seem to gravitate from this field to this field and are most appropriate from the kind of helping / healthcare professions. I've seen physical therapists, occupational therapists come into the aging life care realm, as well as those who have been involved with counseling. I would say many of our members in the Aging Life Care Association, I would say the majority are probably nurses and social workers, although we do have a good amount from other professions. Even medical doctors I've seen, and other, maybe someone with a master's in psychology or something like that. And again, next week, you're going to hear more about getting started and credentialing and things like that. So we have, what does an aging life care professional have? We have specialized training, we have field experience, and we're knowledgeable about community resources. Again, typically we do have some kind of specialized training. And I don't want to get too into it because you're going to hear about it in Shauna's discussion and in Jennifer's discussion. But after, typically you're an MSW, an RN, an OT, and then you might get additional training, be that in care of dementia patients, or specialized training in perhaps running a guardianship program or being a guardian. Maybe you have medical social work experience, or you've been an RN in a nursing home for many years. So one of the most important things to bear in mind, and most aging life care professionals who are members of the association typically have a great deal of experience before joining the association and kind of moving up through the ranks of certification. And Jennifer will talk about that more in the coming week. Certainly, you know your local resources. Shauna's going to discuss some of that tonight. You know where to find the good elder law attorneys. Not only do you know about those assisted livings, but you have the down low information. You have the word of mouth. You can work with families to make the right choice for where they might go for an assisted living or to stay home, for example. One of the things that really distinguishes an aging life care professional or aging life care manager is we follow a strict code of ethics and standards of practice. And I think it's very important to note that when one is a member of the Aging Life Care Association, the consumer understands that that sets you apart from other individuals doing this work who may not have the credentialing, the license, well, forget a license. We are not licensed, unfortunately, and I'll get into that in a minute. But it distinguishes us from other individuals who might be using a term like care manager, care consultant, etc. And in many ways, the aging life care offers that level of consumer protection. So when you look for an aging life care professional at the Aging Life Care Association, you know, your families know, your clients know that you're hiring someone who follows a strict code of ethics and standards of practice. I'll give you some, quick examples. One of our standards of practice, or something that's included, is we don't take referral fees. We don't take commissions. When we're making recommendations to home care, assisted living, they are unbiased and objective. In other words, a home care agency isn't going to give me $200 because I referred one of my clients to them. And I think that is a very important thing that sets us apart. I certainly know in my practice, I tell people that up front because I'm often in the position to recommend a durable medical supplier or a home care agency. And I inform people up front that this is an unbiased referral based on my standards of practice. And again, it offers consumer protection. At the very least, the consumer knows that individuals who are part of this association are required to follow the code of ethics and the standards of practice. As for hourly fees, the hourly fees can vary. Care management or aging life care management is typically fee for service, or what we say private pay. At this point, Medicare and other insurances do not necessarily, there are more specifics we'll get into probably in another discussion about how to get reimbursed, but typically it is private pay. Sometimes private long-term care insurance will pay something, maybe a small amount toward aging life care professionals fee. As you can see, the hourly fee, it ranges from $150 to $300 hourly. Most care managers bill for all of their time, so not necessarily their visit time, but also time on the phone, what we call collateral time, time speaking to a doctor or making appointments, essentially doing all the things that it may take to manage someone in the home comfortably, safely, etc., and providing a really wonderful service to perhaps adult children who don't have that time. They want to be with their parents. They want to have a nice relationship and nice time with their parents, but they don't want to interrupt their workday to be on hold for 30 minutes with a long-term care insurance company, etc. So this is how we invoice for care management services. But I will tell you, I'm in Manhattan, and I think that some people here have even surpassed that fee. There's a big demand here. I know many care management practices are very busy and growing. So we can command such hourly rates. I'm going to go to the next slide. Going to give you a history. Oops, sorry about that. Oh boy, I really jumped. Guys, sorry about this. Why is it going backwards? Sorry, guys.
Nancy, it's fine if I click on the back button, it usually goes backwards instead of the enter.
Is it going back? Yes.
It is, yep.
Thank you, Shauna. Thank you. That was a little scary. Okay, I'm back. Here's a history of the organization, and this is kind of exciting. We're still a really new profession. There's a lot of room for growth, and I know in my 20 years doing this, I have seen care managers do so many unique and wonderful things, and we'll talk about that next week. So in 1983, long distance care of elderly relatives, a growing problem, was published in the New York Times. There were care managers around the country. They weren't really connected. There was a very large New York, Florida connection. I was in high school in 1983, so I had nothing to do with it. Anyway, in 1985, they all got together and had a conference in New York City, and it was attended by 50 attendees. The organization, the national, it was called actually at that time, the National Association of Professional Geriatric Care Managers. Oh, I'm sorry. See, this slide is confusing me. I don't know why 1996 slide is in here. That's for something else. In 2012, we became self-managed. We have more than 2,000 members and growing. This is an important piece. In 2015, NAPGCM, National Association of Professional Geriatric Care Managers, rebranded as the Aging Life Care Association. Again, just to mention quickly, the reason we did this is because the use of geriatric care manager was used rampantly amongst anyone, and we really needed a way to distinguish ourselves. So we became the Aging Life Care Association, and in 2020, we celebrated 35 years leading this aging life care profession. So, we're really quite new. And I think, I can't, sorry guys. Okay. All right. Anyway, we're very new. There's a lot of opportunity. So how do we hire an aging life care professional? Why do we hire an aging life care professional? Well, many of you have probably heard that sometimes people don't want help in the home. And they need it. Maybe they're not able to grocery shop or make meals for themselves. Perhaps they're having difficulty walking. Perhaps there's been a lot of falls. I could go into a myriad of examples, and I will do that in some of my slides, but they're refusing help. They don't need anyone, they're help refusing. Aging life care managers are often called by adult children who say, I don't know what to do anymore. My mom is in trouble. She won't accept help. What do I do? Sometimes we're called in because the individual in need, the older adult in need, or the younger disabled in need, needs an advocate. Maybe they're living in an assisted living. Maybe they're in a nursing home or in the community. Perhaps they're not getting their needs met. Maybe the people who are supposed to be helping them aren't doing what they're supposed to be doing. Maybe they're neglected in the nursing home because they're, I don't know, very nice and quiet and nobody's really paying attention. We can advocate for housing. Care managers, again, can work in guardianship settings where they might advocate for an older adult to retain their independence in the community. Again, we can even advocate within the medical profession. If we bring a patient to a doctor's office and they want to do multiple tests on a very old individual, maybe the family doesn't want that. How do we advocate to make sure that this person gets what they need, but maybe doesn't have to undergo some painful, invasive tests? Well, maybe families are just confused about options. Perhaps a doctor, on a doctor's visit, a doctor told an adult daughter, oh, your mom definitely needs assisted living. You know, case closed. Mom needs assisted living. As we know, and you're going to hear in the subsequent speakers, that's not always the case, right? Home is an option. And there's within the residential setting, there's also multiple options. So I will often get calls, oh, you know, someone thinks they need assisted living. And I say, maybe, wait a minute. I'll be happy to come out, meet with your family, do an assessment, and have a consultation. You know, we are in the position to collect so much information on a variety of issues. And care managers really have to, we need to collect information on our core strengths as aging life care managers. And Shauna's going to go into that in the next session or the next section. But it's very important that we understand our core knowledge areas because we need to give families the information when they're confused about options. Okay, there should be 3 exclamation points after crisis because, and I'm sure Shauna and Jennifer can attest, we're often called in the crisis. I can't say I get called a lot when people are starting to plan. Mostly I get called, you know, at 5 p.m. and someone says they want to discharge my mother tomorrow. Nobody told me this was going to happen. Or, I mean, there are many other crises that can arise. You know, someone could have a sudden mental status change. Someone could fall on the street. I mean, there's a lot of healthcare issues that can happen and cause a crisis. And sometimes, even when we're monitoring the case, you know, for several years, there can be some kind of crisis. So, you know, we're really adept at kind of diffusing those kinds of situations. Family conflict is a big one. You know, again, this is where you hone some of your core functions. Really understanding family dynamics, not necessarily acting as a family therapist, but being aware that family conflict is one of the big reasons that individuals hire an aging life care professional. And of course, memory loss and cognitive impairment. Families are often feeling frustrated. There are overwhelmed caregivers who need advice, who need to turn for resources, etc. And so they hire an aging life care professional. I'm going to go to my next slide, hopefully only that next slide. Yay. Okay. So you're going to find some of this is a bit repetitive, but also it's very kind of reinforcing. It's very important to me, at least, that this is clear and you get a real good understanding of the kind of work an aging life care professional will engage in. So when do you refer? If you're a family in need, when do they call me? When the concerns go beyond your expertise and their ability, one's expertise and ability to help. I can tell you I've had many calls where the well spouse, the spouse that's healthy and maybe taking care of let's say a cognitively impaired individual will say, I've been handling it. I don't know what to do. Things have changed. Things have changed. Maybe so, but when they can no longer handle it, typically that is a good time to call an aging life care professional. Next, simply the family needs information about community services. This could be the kind of information one might find at an area agency on aging or a department of aging. Families might just need to know a few names of home care agencies, day programs, adult day programs, etc. That's another time a family might refer to an aging life care professional. And before I continue these slides, I will tell you that it's not just families who call us. We are called often by attorneys, families, medical doctors, wealth managers. We're often called by individuals who are close to someone in need, typically an older adult, typically, not always. Someone who is close to that individual and recognizes that they need more than they can give. Okay, this is a big one. The client has little or no support from local family members. I've had family in Germany and Israel and certainly around the United States where the adult children simply don't live so close and they need someone who can manage the care of their older adult parents. I want to make sure I'm doing okay with time. Client keeps falling through the cracks and needs an advocate. We see this all the time with frequent emergency room visits. It's really not so typical for someone to be seen in an ER, say, multiple times in 1 month. Now, I'm not going to get into specifics of diagnosis. Certainly that can happen. Is it typical? Not really. Why is an individual being seen in an ER multiple times? Why are they falling through the cracks? What's going on there? Is it anxiety? Do they need more help? There's a number of reasons. Great to call the aging life care professional and find out. Part of the assessment. Back to what I said before, the family needs unbiased information. And again, I can stress this throughout this, today and our session next week. That is gold. That is our gold. That is our gold standard. We can sit down with a family member and tell them about the 5 luxury assisted livings in Manhattan Or we can sit down with a family member and discuss the multiple levels of assisted living and what may be more beneficial for their family member. But we're not getting a commission to do so. And that does exist, and that's okay. They're typically what we call realtors for assisted living, and that's fine. That is their job. They find people a placement and they get a commission. We don't do that. We're providing unbiased information, looking at the sweet spot. What does this family need? What makes the most sense based on the individual's, wants, needs, strengths, weaknesses, and what they can afford. Family disagreements. I mean, this is a big one. Sometimes a lawyer will suggest to a family, why don't you call an aging life care professional? There's a lot of disagreement here. I can tell you about, the legal ramifications of X, Y, and Z, but a care manager can present a fuller picture, right? We're meant to take a more holistic view. And again, Shauna will go in greater detail after this segment of the presentation. We're often called when caregivers feel overwhelmed or unable to move forward. This is a big one. And it's interesting, even when caregivers call us because they're unable to move forward, sometimes it's difficult to, once we're involved, to get people to move forward. Again, expertise about caregiving, expertise about what it's like to be a caregiver is another thing that's important in becoming an aging life care professional. Client needs oversight of existing care. Often we're called, in this case, mostly by family members or attorneys or guardians, because the existing care in the home has become perhaps negligent. Perhaps they're just simply overwhelmed and they need more training. The home caregivers, the home health aides, or independent caregivers. Maybe there's been some financial abuse. That is also, I would say, one of the referrals that we get more frequently in my practice, existing aides. And then leading into that, often and unfortunately, abuse, neglect, or exploitation. I will say we've seen a lot of financial exploitation over the last 2 years. Excuse me. Okay, so how an aging life care professional helps, or an aging life care manager. And again, there's going to be some repetition here. Professional support. We assess needs. We have an assessment tool. We look at activities of daily living and instrumental activities of daily living. We might do a depression scale. The assessment is based on sometimes on various scales used to assess older adults. Sometimes the assessment is based on one's observation of the psychosocial situation. It can vary, but we assess needs. That's part of what we do as professionals. As an aging life care manager, you would also expect to develop a plan of care. You assess needs, you give the family a plan of care. The plan of care may have short-term, long-term, mid-term goals, and often linking to service. How that is done is based on the individual practice, but that is typically the trajectory. Maybe you do your assessment, the plan is in place, you link everybody to service, and maybe some people in the family aren't happy with that. We also do some mediation. We're not mediators, some of us are, not all of us, but we certainly work with the families to come up and agree on a solution that makes sense. And of course, we discuss crisis intervention. I don't need to give you examples of that. Monitoring clients. So I did talk about our hourly rates. Oftentimes, an aging life care manager may be involved with a client for many, many years. I think my longest client may have been 16 years. Although I have two currently who are kind of pushing that. Because families will hire us to monitor. We call that ongoing care management, ongoing monitoring. Sometimes we'll be hired to meet with a client weekly, maybe twice a week. In that visit, we might be monitoring how the home care workers are working with that client. Ensuring, as it says here, how the needs are being met. Do we need any changes or adjustments made to this individual's plan of care? Would it help that, for example, maybe the home care worker needs some re-education on how to transfer a patient? Maybe something's changed and we need to bring in some other professionals. We sometimes speak to our families weekly, give them updates about what's going on. Obviously, this brings peace of mind to the family, and we're always looking to review and evaluate and reassess the plan. Because as you know, in most cases, when we're hired, especially if there's a neurodegenerative illness, that individual's trajectory is unfortunately going to be one of decline and change and increased needs. So we monitor that, we make the changes as needed. We support the family as things evolve and change. So it can be a very lengthy time, and in some ways a healthy intimacy with the family and the client over many, many years. Although it can be an expensive proposition, it does give families an incredible amount of peace of mind. One thing I do want to mention quickly, that if you're a care manager and you're monitoring a client, some care managers do offer a 24/7 kind of response. I do in my practice. Typically, I don't get called. Maybe once a year I get a 2 a.m. call. But it really does give peace of mind to a family, and as an aging life care manager can help you create, you know, a fairly comfortable business. And coordination of care. Of course, we coordinate care. In many ways, I almost want to put coordinate care under monitors clients. Coordination of care can be part of ongoing care management, monitoring client. Coordination of care can be a one-time thing, where you help someone get everything in order and maybe the project's over and you're no longer involved. You find the best solutions and the best options for the client situation. You become the communication hub. It's very interesting with the introduction of the electronic medical record. You know, I used to think, oh, we're not, you know, they're not going to need the care manager as the communication hub any longer. Everybody goes to the record. Not necessarily the case. So we become the quarterback, the communication hub, sometimes for all of the other medical professionals or providers involved. Certainly advocacy, I don't need to go into that. You know, again, under monitoring client, we provide, you know, we monitor and ensure quality of care. And we help if new problems arise. What if we go in and we say, wow, this something's going on with this home care worker. They're just not up to it anymore. Maybe the individual had companion care and it was all fine and dandy when they could take their client to the museum and, you know, go out to a restaurant for dinner. But the minute there's a toileting issue, maybe that care manager's over their head. So again, we coordinate a new level of care. Okay, so choosing an aging life care professional. Again, look at the ALCA membership, Aging Life Care Association membership. There is a spot there where a consumer can actually put in a zip code, a specific city, and find a local geriatric care manager, or aging life care manager. We look at certification. I'm not going to go into so much detail here, but someone with advanced standing in the Aging Life Care Association does hold a certification. And I think it's important to look for that. It doesn't necessarily mean that that person is the most experienced, but because they have qualified for a certification by passing certain tests, it is likely that they have accumulated a certain level of knowledge. Certified fellow, it's just another certification within the Aging Life Care Association. A certified fellow is typically someone who's made contributions to the association, written extensively, presented, etc., and has achieved that status as a master. Years of experience. Let me go to licensed. Yes and no. Some of us are licensed professionals. Aging life care managers cannot be licensed. There is no licensure for the profession. And in fact, as I said in the beginning, it is an unregulated profession. So one may hold a license. You may have a license. You may be a licensed social worker, physical therapist, occupational therapist, RN, but an aging life care manager cannot be licensed. I like to look personally when I'm looking for an aging life care manager across the country. I do typically refer to individuals who have a license and are certified. At the very least, however, certified. Obviously, you want to make sure you should expect that your aging life care manager is responsive. That's really the point. Years of experience, I think that's important as well. The knowledge of local area, Sean is going to talk more about this. You really need to ascertain what the geographical area is that your care manager is working in. I handle Manhattan. I know I live in New York City. There are 5 boroughs. There are a lot of nursing homes in those 5 boroughs. I don't know, maybe I know the name of one nursing home in Staten Island. I like to stick to my very small geographical area because that is where I am most knowledgeable. I would not expect someone to hire me and say, give me information on Staten Island, and then I have to pay them to research what's out there. I would not do that. I would then refer them to someone in that local area who understands those resources. Look at what kind of services your aging life care professional provides. You may find an aging life care professional that only wants to do psychotherapy and maybe works in assisted living now and then. You may find an aging life care professional who offers 24/7 care and 24/7 support has all the medical background, such as a nurse. You may find someone, some aging life care professionals, particularly nurses, may provide services like packaging medications or monitoring the home care workers who may or may not be providing skilled care in the home. And you want to ask about fees. And we went into that already. And I told you what to expect. I think on the coasts, it's probably $300 an hour at this point, and anywhere in between, depending on the knowledge of the care manager. Okay. And that's it. I am going to pass this along to Shauna, unless there are any questions. Do we want to do some Q&A?
So I see some questions here in the chat. I don't, Nancy, if so one question is, do you normally work with the family or the individual?
That is an excellent, excellent question. And we certainly don't have time in this presentation to talk about our standards of practice. But our standard number one defines who's the client. So whereas where we may be hired, let's say by an adult daughter or a lawyer or a guardian, our services are always geared toward and on behalf of the individual in need. Our client is always the individual in need of service. But in general, I would say we work with the client system. Whereas the older adult is my client, we still work with adult children and anyone else who is in that sphere, medical doctors, home health aides, et cetera, et cetera.
And we have another question from Marnie, and I'll read this. I'm so excited to be here. Thanks, Marnie. Thank you. I've always wondered what a care manager does, and it sounds like such a rewarding job as you're helping so many elder people and their families. Can you start your own business right out of college?
That's an excellent question. And I am going to probably encourage you to, I hope you're attending next week because Jennifer's really gonna take a deep dive into starting one's own business. I will say, however, generally you need a few years of experience if you're gonna do it on your own. But certainly I'm seeing aging life care professionals hired out of college through larger aging life care practices.
And I'm going to share a resource from Penn State Abington that provides support and resources to aspiring entrepreneurs and people that are looking to support or to start small businesses. This is our launch box. So if you need additional help or questions about small business and entrepreneurship, I'm just going to share that in the chat too.
Okay, so I guess I would like to turn it over to Shauna. Thank you, everyone.
Thank you. And did we want to give people a 5-minute break to get up and stretch your legs or use the restroom or grab a drink? Water.
Okay, let's take a 5-minute break to all of our attendees so that we can get up, stretch, and then we'll come back in 5 minutes and continue on to part 2 of tonight's session. So we will be back at 6:56 Eastern time. Okay, welcome back, everybody. And I think we can get started again, and we can turn it over to Shauna.
Hi, I'm Shauna. So I'm going to talk about the 8 areas of domains. So this is from the Aging Life Care Association. So I would recommend anyone thinking about being a care manager to join Aging Life Care Association. There's presentations there, great resources. And I think it's really important to attend conferences, gather as much information as you can, because families are looking to you to be the expert. And I know the question about, can I start right after college? And I think that's a really good question. And it depends, do you have some life experience behind that? Kind of where are you at with that? I think always graduating from college, it's important to have learning from peers. And I think that's really hard to do as an aging life care manager, because you are kind of working independently. And of course, there's resources out there and books and classes and conferences. But I think just as a new nurse, I felt like I really needed other nurses to learn from in the very beginning and kind of get my footing, an area of expertise behind me before diving into working independently. But the areas that, the 8 areas of knowledge for aging life care managers are health and disability, financial, housing, family, local resources, advocacy, legal, and crisis intervention. And we're going to go over each of these and the things that you should know about each of them. So what does expertise in the area look like? So you need to know enough to recognize that there's a gap in care. So you need to be able to recognize what the problem is, as well as know the resources in your area to refer clients to, and the experts who specialize in each area. So even though you might not know the answer to every single question, you should know who you need to reach out to in order to get that information, or who to connect your families to so that they can get the help that they need. And then you need to know when your goals are being met to maximize their quality of life. So this is a little process, an icon that Jennifer and I came up with because we wanted a simplified way of, first of all, explaining what we do, as well as a process or methodology of how you're going to work as a care manager. So the first part is just learning. So understanding the situation through the comprehensive assessment. So learning about your client, learning about their family, what their resources are, and having a good understanding of what their needs are. And then create is developing a plan of care with recommendations that we'll talk a little bit about in a minute. And then the manage, which is implementing the plan of care and then monitoring their progress. And it's a circle, because as you're managing their care, their situation is going to change. It might get better in one area or worse than another, or their situation has changed. And so you're always learning more information about them, modifying or creating, the original plan of care, marking off things that you've completed, recreating new problems, new goals, in order to maximize their quality of life, and then managing the situation through that process. So the assessment part is learning about their situation and the client themselves. So Nancy talked a little bit about this, about the holistic assessment. I think a lot of disciplines are micro focused on their area of expertise, and care managers are more, they're looking at things from, thinking about looking at it from a high rise down into what their situation is more holistically and putting all the pieces together. So the assessment is comprehensive. It typically goes from more easy answers and more conversation to more uncomfortable answers, because you want the person to be able to get familiar with you, get comfortable, so that you're not starting off like, oh, we're going to do a cognitive screen. Let's see what your cognitive status is, which is really scary, or let's talk about your money, which you're going to be turned off on right away. So it's looking more about like, tell me about your family. Who are your children? What are their ages? What do they help with? So more easy answers and getting to know them and making them comfortable. And then you can see you move into support services. And in the parentheses, I put what the area of specialty is, or the domain of specialty, or the domain of expertise that you're kind of focused on for each of these different areas. And then you ask about their medical and health status. So looking at what are your diagnoses, what are your medications that you're on? And I would say, even if you're a social worker, me with a nursing background, you know, I kind of focus on that a lot, but people with social work backgrounds, they also ask that, because you need to know if someone is, you know, on a medication that's causing, you know, a side effect of dizziness and they're falling all the time, or they're not managing their diabetes very well. And then, you know, they're falling or getting lightheaded because they're taking their insulin wrong, or whatever the case is. So even though you might not have like a nursing background, it's important to have that aspect of the assessment as well. Daily habits, and just like I should digress to the support services and local resources, me as a nurse, that's something that I had to learn. That comes very natural to social workers, and they're very good at that. They know the resources, but that's an area that I was weaker in as a nurse, and really had to learn that and meet people and get out there and network and learn my resources out there. So we're all going to have our, you know, areas of specialty and these areas that we feel more comfortable in. And then there are going to be areas that you need to grow and develop as the care manager. And then daily habits and routines. We ask about, you know, what time do you wake up? What time do you go to bed? Do you feel well rested? What do you eat throughout the day? So we learn their habits so that we can see any pitfalls there. And then their functions. So activities of daily living and instrumental activities of daily living. So how do they dress? Can they bathe themselves? Can they go out and shop by themselves? Do they need help with any of these things, so that you know what kind of areas need supported within their home? Cognitive status. So this can be uncomfortable for some people, but it's really important to screen to see if they have signs of any cognitive disability, so that you can speak to the physician, get to the bottom of it. Is it something that's reversible due to medications or an infection? Or is it something that, like an Alzheimer's diagnosis, that's going to progress and get worse, something that you're going to have to help the family plan for? And then you're going to do a safety evaluation. So safety, looking at house safety within the home safety, as well as crisis interventions. So they might be in the middle of a crisis now, but also how do you plan for crises in the future? And what is your plan if something were to happen? And then looking at their finances. And this is important because you need to know what kind of availability, what kind of items are available to them, either through their insurance, what kind of insurance they have, what does that cover? Do they have long-term care insurance? Are they a veteran? Can that cover any services, as well as what's in their bank? What kind of assets do they have? Because you don't want to make a recommendation that's private pay. That's going to be, you know, $10,000, $20,000 a month, and they have $5,000 in the bank. So it's important to discuss that and get to know what their finances are, so that your recommendations can reflect what they have in their accounts, and make sure that your recommendations are sustainable for them. And then looking at legal aspects. So do they have a will? Do they have a power of attorney? What kind of paperwork do they have in place, and what kind of gaps are there, and what do they need? And then looking at psychosocial also. So I think it's important to ask what kind of spirituality they have. What is their background? Do they attend church? Do they still attend church? Because we see a lot of times people as they age, they really loved attending church or being involved in the Jewish community or whatever their faith is. And they've stopped that due to being unable to drive or not being able to get there or just feeling isolated. So things like that are really important to help improve with socialization, recommending senior centers and ways that they can get back out and socialize, because that's such an important part of our lives and improving quality of life. So after you go through that whole assessment, you're going to create a plan of care. So the plan of care is identifying needs or areas of concerns, creating goals, looking at any barriers, and then writing specific recommendations. So that might be area of concern is safety. And we're worried because this person is falling all the time and they're at a high risk for falls. And their goal might be to no longer fall or to stay out of the hospital, be safe. Barriers might be that they have a walker, but they refuse to use it. They don't like it. They feel old when they use it, or they forget to use it. And then what are your action plans or recommendations? What kind of things are you going to recommend so that they stop falling? Maybe it's, talking with the doctor about medications. They're on many medications that are at high risk for a fall, or maybe it's pulling up rugs or recommending physical therapy to improve strength. So these are your action plans and recommendations. So I'm going to just go through the domains. So the health and disability is the first domain that I mentioned. So during the assessment, again, you're going to collect information such as their diagnoses, medications, cognitive status, activities of daily living, instrumental activities of daily living, like dressing, bathing, toileting, what do they need help with? And then looking at goals and optimizing their health and ability. And what expertise you need is just knowing what the normal aging process is versus a disability issue. You don't want to make a recommendation when someone is in the normal range of aging, that it's something that you can't help, that you're, not going to be able to do anything about. Knowing their medication uses and side effects, not that you need to know them off the top of your head, but you should know the resources out there to look up medications and contraindications, and do they know what they use their medications for? And if not, can you provide education on that for them? Common chronic health conditions that may affect quality of life, healthy diet and exercise routines so that you can provide those handouts or teachings or help support them to improve their quality of life, and administration of cognitive screens. So looking at things like, I know I like the SLUMS, it's the St. Louis University Mental Status, and they do have, those trainings online in the St. Louis University. And knowing who to refer to for the experts are just the primary care provider, geriatricians, neurologists, nutritionists, and therapists. So physical therapy, occupational therapy is who you would refer to, and to get more information or just connect them with those services. Next one is financial. So the assessment would be collecting health information like their income, their expenses, their power of attorney information, what are their benefits and insurance, veteran status, and ability to afford care. And the goal is to find resources within the client's means and optimize their quality of life, and payer sources to create long-term plan that fits within their budget. And the expertise you need to know for financials. So when we talk about financial expertise, we're not talking about being the financial advisor and managing their money or anything that in depth. It's really just knowing what is a power of attorney, What are, guardianships are ruled by the state. Do you know your guardianship rules and your local probate courts and their rules around guardianships? Or do you know the local guardians, attorneys, or guardianship professionals in your area? A knowledge of veterans benefits and know when to refer to a professional such as a VA attorney. So we don't expect you to be an attorney or like be able to apply for veterans benefits and know, that much in depth in every area. We would just want care managers to know what is their local veteran office. What can they refer them to, a veteran there to? What kind of benefits might a veteran be eligible for so that you can connect them with the right person to be able to apply for that? And then a general knowledge of health benefits. So what insurance pays for or doesn't pay for. And you might not know that off the top of your head, but being able to recognize, hey, there's a number on the back of the card, we can call for this, or we can ask their physician, is this something that can be paid for, and know how to find that information. A big one is how to read long-term care benefits. So just attending webinars or just getting familiar with long-term care insurance, what they pay for, reading over some of those policies and becoming familiar with them. And then comfortable discussing personal finances with the client and family, looking at trusts and estate planning and elder law attorney resources. So typically elder law attorneys are a really good referral source to care managers, as well as care managers are a good resource to refer to elder law attorneys. So it's important to get connected with those professionals, take them out for coffee or lunch or get to know them and pick their brain. And a lot of times they're more than happy to help you if you have a question or, hey, I have this client with this situation. Is this something you can help with? And that's how you get to know, like me as a nurse, I didn't know much about elder law attorneys and powers of attorney and trusts and that sort of thing. It's just knowing the questions to ask and learning more and more each time and becoming knowledgeable. Financial experts to refer to are elder law attorneys, estate planning attorneys, guardianship attorneys, veterans attorneys, and a lot of times the veterans attorneys are also estate planning attorneys, or elder law attorneys do estate planning as well, or guardianship attorneys might do estate planning. So sometimes these cross over. And then financial planners, benefit specialists, and daily money managers. Housing is another area of expertise. So looking at things like, are they safe living in their current living situation? What's their fall risk? Long-term ability to remain in their current living situation. So do they have a chronic health condition that's going to continue to deteriorate, like a, Alzheimer's, some sort of dementia that they're going to continually decline, where it's not going to be safe for them to be in the home anymore? What kind of supports are in the home? And then the goal is to promote safe and long-term planning for living arrangements. So in the beginning as a care manager, I thought that I had to make those decisions early in my career. I was like, oh, they're looking to me to decide if their mom and dad can stay at home or if they're unsafe to be at home, or do I need to place them in a facility? And it's really not so much like the care manager is making that decision. It's giving them options and trying to look into the future of what the costs are of, this is what, if they were to remain in the home, these are their needs that you're going to have to put in place. This is the estimated cost for this. This is, sustainable or not sustainable based on their diagnoses, if they're going to continue to need to have more and more supports, as well as their finances. Will their finances support them being at home, which can be very costly, versus a facility, and this is what the cost is. If they continually decline, this is what the cost is for, more support in a facility, because, assisted living is different cost than long-term care and so forth. So just arming the family with as much, and the individual as well, with as much knowledge as you can, so that you can help them make the best decision for themselves and their families. So things that you should be knowledgeable about with housing is, what is the difference between independent living, assisted living, skilled nursing, what's a continuing care retirement community, dementia care living, and veterans living resources. So again, as a nurse, this is something that I had to learn, and how do the different places charge? What are the criteria for the different places? So again, just reading and becoming knowledgeable about that. And some care managers do placements, so they help them transition from the home into like assisted living, or from skilled care into a long-term care facility, and so forth. And some care managers are not comfortable with that. And there's other professionals in the area that do that sort of work and just do that work, so they might refer to them. But I think it's important to still know the general different levels of care, because you will come across it, and you can't always, for one transition, refer to a professional. You should be a little bit knowledgeable to help them through that next step. Because a lot of times, like Nancy said, you'll be called in an urgent situation and they're being discharged tomorrow, and you should know, the different care levels. And you should know the payer sources for each level of care in order to project costs. So you don't need to know exact costs, but you should know in general what it costs in your area for an assisted living versus long-term care. And you should also know things like what Medicaid pays for, that they paid for, skilled care out of the hospital, but they're not going to pay long-term for assisted living. Or I should say Medicare is not going to pay for long-term assisted living, but there are some assisted livings and long-term care facilities that take Medicaid. So just that's like a lot of information, and there are resources out there to learn those sort of things. So just arming yourself with that knowledge. And then family. So looking at your assessment, which families support the client? So which ones are the caregivers, or how do they support the client, either financially or physically? Who are their emergency contacts? Mediation and family conflict resolution. So a lot of times care managers will be in a situation where there's multiple children and they all have a different idea, and they all have the same goal of caring for mom and dad. And, they all want the best for mom or dad, but they have different ideas of what that looks like. One might think that they are safe to be in the home. Another person thinks they need to go into a facility. One thinks, well, we need to just leave mom and dad alone and they can make their own decisions still. And, you just get this myriad of different opinions, and sometimes arguments and conflicts. And it can really throw, even a family that doesn't have much dysfunction into a lot of dysfunction and arguments. So being able to mediate and kind of be that person that helps navigate them through that situation to take out the different personalities. Identification of caregiver burnout. So when you have individuals, children taking care of their parents, sometimes they take on way too much and they can have a lot of burnout and just, I don't know what to do, so I'm doing it all. And, being able to step in and help provide some relief for them. And then long-term plans to promote what's best for the client with an unbiased opinion. And I spoke a little bit about this with the conflict that, you're going to come in and, focus on what's best for the client, not what's best for, their son, John, or their daughter, Sally, who's the one that called you, or they're the ones that might be paying your bill, but you're still working on behalf of that client and what's best for them, not what's best for your payer source or, who's ever in your ear first, telling you all the problems and all the other kids' dysfunction or whatever. You're really going to focus on your client. And I think that's really rewarding too. You get to see, help a lot of families. And as a nurse or social worker or whoever else with, a background in healthcare or whatever your background is, most times you start out in the field because you really want to help people. And it's you get to see, because you're a consultant and your role can be limitless. You do get to see a lot of benefits of your work and seeing people living much better quality of life due to what you've done for them. Local resources. So I mentioned this a little bit, that as a nurse, I really had to learn my resources because that's more of like a social worker background. And I always think care management is like a little bit of different disciplines, right? It's a nurse looking at the medical information. It's a social worker looking at resources, putting it all together, a geriatrician looking at seniors, therapists looking at function. So that's why there's so many different backgrounds with care managers, because it does fit into a lot of different backgrounds and realms and areas of expertise. And what you might be a little bit weaker in, someone else might be stronger, but it's really trying to hone your skills of your areas of weakness and growing those to benefit your clients. So when you're assessing resources, you're looking at what is the client currently using. You don't want to recommend something that, they're already utilizing it, that they've already tried. Like if they've tried Meals on Wheels and they've hated it and the meals are awful and they'll never do it again, you don't want to not screen for that and like write in, we recommend Meals on Wheels, because they're already not going to like you, right? So you want to make sure to screen for what they've tried in the past. Did it work? Or what kind of things are they currently doing that are working or not working? And then where are the gaps in the care that the life care manager can connect the client and family to maximize their supports? So it's important to start your resource database and look at what the resource is. What is the charge for that? Does insurance pay for it? Is it all private pay? What is the cost? Do they have a wait list? So all these things are important so that you can pass that information on to your families. So you can look at resources as local resources, so the ones in your local community, as well as national resources like Alzheimer's Association, that even though they have a local presence, it's really a national organization. So things like you can organize them by therapy, like occupational therapy, physical therapy, skilled care, home-based care, knowledge regarding holistic care to address possible diagnostic testing with providers, architectural resources. So again, this is something I had to learn. Like I was looking for, home modification people to just put in a bar. And I learned, that can be done by a local plumber, typically just put in little bars within the bathtub for security. And then it's not as long as a wait, it's cheaper. So after you learn that, calling some plumbers around town then and getting different costs and putting them in your database so that you have them for people in the future. Home modification specialists, as well as bathroom modification specialists. Transportation resources, so medical transport for people that are in wheelchairs versus other transport when people are more independent and they just need to get maybe from point A to point B. Medication resources are important. I can't even tell you how many homes. I would say, if I had to guess, around 90% of people that I did assessments in their home and didn't just say like, oh, what are your medications? And written them on a list, which is what every physician does, right? Going into their home and saying, so can you, okay, give me your list of medications. Okay, now show me your medications and show me how you take your medications, and looking at the pill bottles and seeing if there's duplicates or if there's, empty pill canisters that they're like, that are 3 months, been refilled 3 months ago. And oh yeah, I've been meaning to get back to get that filled, or I keep forgetting, or you see things a mess, just like I've seen people, instead of like the Monday through Friday pill packs, they put a day's worth of pills inside of each empty pill container. So it would say like Lasix 40 milligrams, and that's 1 day's worth of pills. Like, it's just unbelievable how some people take care of their medications, or don't take care of their medications, I should say. And it's just a mess. And once you get their medications straight, they just make a huge turnaround. And knowing your like medication administration machines and different resources to help get their medications back on track. And then supplies and durable medical equipment. So there are national resources for this, but there's also local resources. And in the beginning, I really liked my local durable medical equipment store, because you could go in, speak with the owner. Mine was a little shop in the middle of Columbus. You could say, hey, my person is having this or that issue. They need a shower chair. This is what their issue is. Which one do you recommend? And you're seeing like 6 different kinds, and they're really knowledgeable and can help you. And then you get to learn on your own. And then you can get more on the online or national places. But I always think it's best to connect with individuals while you're learning about these items. And then social and spiritual resources. So this is where we talked a little bit about making sure people's socialization and their psychosocial needs are met, and their spiritual needs are met. So looking at day programs, senior centers, and we have a whole list for my company of senior centers. We have their calendar of events. And even though we don't update it every single month, because we don't need to, they kind of repeat themselves each month. So you get to learn what kind of activities they have, what are their times that they're open, do they provide transportation and that sort of thing, as well as local church transportation services. So I can't tell you how many times we called a church because someone stopped attending due to transportation. And most churches do have someone that will they have a buddy volunteer program where someone will go and pick them up and take them to church each day. So not only does that provide transportation, but then they get to know someone else in the church. They usually sit by them and communicate with them. And it's a really nice way to get them back into their church. And then home communion and prayer. So we have resources where people will go out to the home and they'll give them communion within the home or pray with them. It's typically a volunteer program. So that's nice as well for socialization. Support groups. So Alzheimer's Association is a really great resource for families as well as individuals. And for our Alzheimer's Association, we keep the brochure of the different times and contact people for those support groups, and we give them to families that need a little bit more support. Volunteer home visits as well as hospice. And more local national resources, area agency on aging, support groups, and then national organizations such as Alzheimer's Association, National MS Society, and Parkinson's Foundation. And you'll come across as a care manager all 3 of the people with all 3 of these diagnoses. So advocacy is a part of care management. So I get the question a lot, like, oh, what's the difference between a care manager and a patient advocate? And I would say they have a lot of crossover where they, have some similarities, because a lot of care managers, they do attend doctor's visits so that they can let the physician know what they're seeing in the home, that little typical doctor's visit of 5 to 7 minutes. It's really hard for the client themselves to say what's happening, what kind of issues they're having. They're in and out. to get the gist of what's going on. So I'd say advocates as well as care managers attend doctor's visits, let them know what's going on in the home, help, when the doctor makes a recommendation, helps the client follow up with that recommendation and next steps, and then reattends another visit to know, did it work? Did it not work? What kind of tweaks do we need to do? And that sort of thing. I think what makes care managers different is that resource piece, as well as the focus on seniors. And it's not quite as medical, where patient advocacy is more medical, like people seek patient advocates because they have a new diagnosis of cancer or something, a chronic condition is flaring up, or they can't navigate the healthcare system. Whereas care management is a little bit more holistic in what's going on with this senior or younger person with a disability, and how can we support them and improve their quality of life. And as a care manager and advocate, going through that process of learn, create, manage, managing that ongoing care, being an advocate for the client, and making sure you're doing what's in their best interest. Never taking, like Nancy said, never taking a referral fee, and just making sure with those standards of practice from the Aging Life Care Association, always making sure that you're doing what's in the best interest for the client, not what's in the best interest for your pocketbook or money or, referral fees or cross referrals because someone else is going to refer me a client back. You're truly doing what's in the best interest for that client. And then non-biased recommendations during family conflict. So not taking one of the kids' side, whoever has the loudest mouth or the, paying your bill or whatever, you're doing what's in the best interest for that client that you're serving. Looking at legal expertise. So does, during the assessment, looking at, do they have a power of attorney in place? If not, that should be a recommendation to have in place if they don't already have that cognitive disability and can make that choice before it's too late. Do they have a guardian, or do they need a guardian if they do have if they don't have the ability to choose a power of attorney due to their cognitive decline? Looking into guardianship. Do they have a trust that can help pay for their services, or will they need Medicaid in the future? So the legal experts that you would be referring to are like attorneys, elder law attorneys, guardians, veterans administration, probate, estate planning, and personal injury. And I should say too, as you guys have questions, just put them in the chat box and we can answer any questions at the end. So feel free if you think of anything. And I also want to encourage you, even if it doesn't have to do with our slide or presentation, if you have a question in general about care management or about the practice or just something that's on your mind, feel free to put it in the chat and we can answer those at the end of the presentation. And crisis intervention. So looking at things like, do they have a crisis plan? So we talk a little bit about if the person is in, we'll say, California, and looking at your area of disaster planning as well. So if they're in California where all the fires were, do they have a plan if there's a fire? What is their action plan? So I'm in Columbus, Ohio now, but I lived in South Carolina for a while, and we had an action plan of, if there's a hurricane, what do we do? Do we have the boards for our windows? What is our exit plan? Each person had a different route so that the roads don't get clogged. And then just, depending on your area, if there's tornadoes in your area, what is the action plan for that? So just making sure that your clients have a plan, as well as you have a plan for yourself, because you can't help others if you don't help yourself, as well as your business. So once you have a business, making sure that you have a crisis plan in place for that as well. And then in case of emergency, do you know who to contact? Because I can't tell you, we've had a pretty good handful of people that have used our services. We collect who's the emergency information, who's the power of attorney for decision makers, what's their list of providers, because it does come back a lot of times to, when there is an emergency, we're the first ones called, even though we might not be actively working with that client. People know that we collect that information and they come to us with that information or for that information. And again, this is just the learn, create, manage. So learning and understanding the situation and then creating that plan of care and managing that care. And the overall goal of all of this, so to have your base of knowledge and knowing where to go to get more information, it's really to optimize the quality of life for the vulnerable population. So seniors, individuals with special needs, individuals with chronic health conditions. Because if you don't know your resources or your connections or those, finances, your areas of expertise, then you're going to have gaps in your recommendations. Because if something were an easy fix or a Band-Aid fix, most times they're going to be taking care of that themselves. They're coming to care managers because they know we're looking at the whole picture, can put things together. We know the resources and can dig a little bit deeper into what the true problem is. At this time, I'm gonna take any questions and answers if anyone has any. And I'll also.
I was just gonna say that I haven't seen any come through just yet.
Okay, I'll also put it over to Jennifer or Nancy if you have any input on the 8 domains or anything else that you would like to add to that part.
I'd love to ask a question, and I was so happy to see that you have a slide comparing care managers to patient advocates. I'm just wondering if you can speak a little more to that in terms of like the training that we have to go through and our expertise.
Mm-hmm.
I mean, I think anyway, yeah.
Well, there's, I actually did a whole blog on it. So first of all, we have different organizations. So patient advocates, they typically belong to the, there's a few different patient advocacy organizations, but the big ones I can think of are like the Alliance of Professional Health Advocates and Greater National Advocates is another one. Health X Advocates is another one. So there's different advocacy organizations versus the Aging Life Care Association. And they each have their own standards of practice. So I think the big thing with Aging Life Care managers is they should belong to the Aging Life Care Association, following those standards. And again, looking at a more holistic view, connecting with general, community resources versus being more patient advocates, I feel like are more medical based. Not that we don't look at that as a piece of the puzzle, but it's not our core focus.
And Shauna, we had somebody who asked if you would be able to share your blog that you just referred to.
Sure. Let me find it and put it in the chat.
Okay. And while you're doing that, we also had another really good question that came in. And I think probably anybody can answer this one. What do you like most about being a care manager?
While I'm looking for this, I'll let you guys answer that.
Yeah, go ahead, Nancy. I'll go after you.
Okay. I mean, I love meeting the clients and the families and just being involved in solving a puzzle, basically.
Yeah, I would agree. We often are putting the pieces of the puzzle together and then we're helping straighten it out. And so I especially, I'm a nurse by trade. And so when I started my practice, I didn't want to let go of all my knowledge and my wisdom and stop caring for people. It was part of who I am. And then, just being able to care for someone at their greatest time of need, we talked about crisis intervention because we often do get called when it's a time of need. And individuals and families have not gone through an experience such as what they're experiencing at that moment. And we have to try to help align them, with the optimal well-being. What is it? The medical treatment plan, and try to, there's a lot of moving parts. Shauna presented on the 8 domains of knowledge, and the Aging Life Care Association, has published those 8 domains of knowledge because they know that we absolutely have to hold ourselves accountable to be competent in these areas. Does it mean that you have to come right out the gate being an expert? No, you're not. We call ourselves aging experts, of course, because we've been in practice for a number of years, most of us decades. But we work together. We use our resources that are available to us, our books, our textbooks, our classes, our conferences. And that too is very exciting because, being in a business that allows you, an entrepreneur allows you to travel a little bit. If you can, and you should always budget for professional development or at least be amongst your peers and learning. And so there's not only like the use of my background and knowledge, really understanding the physiological process that's happening to my client, and also a lot of psychology with that as well, but also collaborating with others, learning from others, and then really, there's nothing better than really walking alongside someone and seeing those outcomes that you've been working on be achieved. And the person thank you. And it's a really special role that we play to help people through their times of need and to hopefully accept where they are and live out the remainder of their years with a little bit higher quality of life.
And I put the direct blog about the difference between care management, case management, and patient advocacy in the chat, as well as just the general blog link.
Thank you.
And for myself, oh, sorry, I was just going to
I was
say.
going to say thank you for sharing that, Jennifer. I thought that was very insightful for somebody that's looking to go into this career.
Yeah. So what I like about care management is just the, of course, you get to help others, and I've seen it make a true difference more so than being a nurse in a hospital. I feel like I've made a bigger difference, as well as just being a business owner is just, it's creative. I'm an artistic person, so I feel like I can be creative and do different things with it and kind of morph into how can I help even more people. You can think outside of the box and do a little bit more with it, as well as it's just fun to be your own boss and like travel when you want, take time off when you want, be in charge of your own schedule. Like all of that is just a lot of fun as well.
And we have a couple other really great questions that came in. Somebody asked that they noticed many advanced degrees, not only with tonight's presenters, but contributors to the LCM handbook. Would having only an associate's in nursing multiple years and CCM negatively impact my success as a life care manager?
I would say absolutely not. I think having that's a really good background. I started out with an associate's degree in nursing, even though I went for my bachelor's and master's as an adult. I had my associates until I was, 32 years old. And I think it's a great thing if, you have the handout, you're attending this session. So I think it's great. You're trying to learn and you're gathering that information. So right there just shows that you're motivated, you're a learner, and that you want the best for your client. And I think those are the most important things.
And I would
think
say
right
too
with
that
your
there's there's really a trend in skills-based and competency-based hiring and learning. So anytime that you can have to kind of, like you said, Shauna, like be a lifelong learner and earn extra certificates or certifications, whether they're credit or non-credit, is always helpful. But I do see more and more employers and organizations looking at skills, experience, and ability to learn as hiring criteria.
Mhm. As
And-
well as you're being self-motivated. I think being a business owner, you have to be self-motivated. There's no one, there's no deadlines. You're your own deadline. So if you're attending this and wanting to learn more and, motivated, that's the biggest step.
And we have another one. I am a new CMC and a speech language pathologist. We say congrats. Have you made referrals to speech language pathologists, and do you know many SLPs who are care manager certified?
I don't know any in my area in Montana. And it's great. It just shows you that the multidisciplinary approach to what we do, it could be relevant for anyone working in a rehabilitative setting, because you're already taking on a holistic viewpoint of the patient client, right? We call them clients in our world. I have, as a care manager, referred my clients to speech therapy, but I have not worked with a care manager that is a speech therapist. So speech therapy is really effective for individuals that I serve that have had a stroke. We also have some individuals with early cognitive impairment and memory loss, and then Parkinson's, of course, has a number of programs working on the voice strength and all that. So.
Yeah, I would say I've been in charge of organizing conferences before, and we always have a handful of speech therapists. So it's not like there's many out there, but I think there's definitely a need for it because speech language pathologists, right? You guys deal with memory a lot of times, and speech and all of that affects seniors, and it's, a healthcare background. So I think it's a great background to have as a care manager. And Nancy, you've been around longer than Jennifer and I. Like, what do you have to say about the speech
I
background?
was still in high school in 1983. I think it's fantastic. It makes perfect sense to me. And I hope we see more of it because, as you all said, the medical background, dealing with cognition, you're dealing with neurodegenerative disease. It's, because once you get all the coordination under your belt, and I know, Jennifer's going to go into this next session, but, there's things that you have to think about in terms of your skills. The knowledge is great. The fact that you have a CMC is great. Now ask yourself, are you a multitasker? Are you a life learner? Are you a kind of person who's responsive? All the kind of things Shauna was saying about, being kind of someone who works for yourself. But I think it's fantastic. I think speech pathologists would make great care managers, or do.
And I have one final question. We recently launched a rehabilitation and human services major at Penn State Abington. And I'm just wondering if there are current undergrad students that might be interested in a career in aging life care. Is there anything that you would recommend for them to do in addition to their studies in a rehabilitation and human services degree? It's very, very exciting. It was really recently launched. And we have wonderful students that are coming into the program, but if they might have a desire to go into or learn more about this career, is there anything that you'd recommend to do in addition to their studies while they're in college?
Well, I would just say, pick some internships that may focus on some kind of, take a multidisciplinary approach so you can get that experience, especially with older adults.
Yep.
If that's what you want, the population you like to serve.
Well,
Go ahead, Jennifer, sorry.
It's hard, without knowing exactly what their curriculum is in those studies, it's hard to tell you what extra there's a lot of things that we don't necessarily get in the college setting. And I can say this, I went to Ohio State University in a 4-year bachelor's program, right, as a nurse. That's I get my bachelor's of science in nursing. Anyway, I didn't have a lot of mental health background. I also did not learn a lot at that time about Alzheimer's and related dementia, cognitive impairment, and memory loss. I also we learned a lot about the human body, but not necessarily what normal aging is. And so now, of course, I'm generalizing because I did get some, I did get a well-rounded education. But you can only focus on so much. And so as you're going through a program, you can kind of look for areas of that you might want to expand on, and areas that you might not think is necessarily in a total academic setting or a college credit course, or it might be like this. It might be an adult learning session or something online through a webinar. But also really aligning kind of where your passion is as well. And I think that's, really personal development, professional development goes a long way in understanding where your strengths are and where you can have areas to grow in. And, my passion tends to be Alzheimer's. And so that's one of my certifications, the credentials behind my name. It's a choice that I made to go ahead and become a certified dementia trainer and practitioner. But anyway, I guess I don't know, Shauna, you were going to add something, but how do we, getting life exposure to volunteering, I tell you, in your community and geriatrics and just helping those in need really lets you, are you comfortable enough? It's going to tell you, am I comfortable enough helping this individual who's really struggling,
So, and I just think if you can attend a conference, I think they have, does the Aging Life Care Association have, I think they have a scholarship that you can apply for, student membership. So joining that, and I know Nancy, you've done classes for Aging Life Care Association that you can access for a cost. Some are free if you're a member, which is great. But I met Jennifer at a conference, and I think there's no better way of meeting people, collecting their business cards, having someone that you can call and ask questions to, and what do I do about this? And of course, that's why me and Jennifer started the Life Care Management Institute, which is lcmexpert.com, is because we know there's so many people out there that would love to do this. And we felt like there were a lot of people that just were like doing the same thing that we did when we started. And I'm sure, Nancy, you did it for, a long time now, and there was nothing out there, I'm sure, when you started, and we all just are starting these businesses and all trying to figure things out as we go. So that institution and website has classes and the book and everything that you need to walk you through how to get started, so that you're not learning like we did by trial and error and calling Jennifer on the phone and what do you think I should do about this? There's so many more resources out there now than there were, and it's growing. And, with the association, with us, with just lots of things out there, just get connected and get learning.
Great. Thank you so much. To our attendees, we are having part 2 of this session next Tuesday, September 20th, the same time, 6 p.m. Eastern time. And it is the same link that you used today. And we will be sure to send that out to you just to make sure that you have all of that as well. And Jennifer, do you want to just share what will be talked about in part 3 or part 2? I'm sorry. And you're just on mute.
Thank you. It's so good for all of it. So Tuesday, the 20th, part 3 and part 4 will be presented. So it's the final sessions, and it's on opportunities. And then finally, now what, like how to get started. So, and that would be even reviewing things to like how to know if you're a good fit. And so we'll be continuing a little more about like what we just talked about. And hopefully it'll give us time to a week to kind of digest, Christine, your question that you posed, which is, about what suggestions would you have for learning, outside of the scope of like the college curriculum for the you said it's in human services curriculum. anyway, so we'll be, I'm looking forward to that next week. And this was a lot of information today, for sure.
This was fantastic. I want to thank you, Shauna, Nancy, Jennifer, for joining us tonight and next week as well. This was super helpful. I learned a lot. So thank you, and take care, everybody.
All
Yeah.
right. Thank you guys. Take care.
Thank you.
I thought it was awesome too. Thank you, Jamila. So I have to ask, is there a certificate program that you do with your institute and or the ALCA?
So we don't have a certificate right now. It's something that we might put in the future. Right now, it's just the classes. And it's brand new and it takes you through, like, one series is how to do care management. And then another series is like the business. And then there's a la carte ones, like how do you price your services and how, like, about HIPAA compliance and things like that. There's not really certification. There is, I know my dog, he is like,
I know, mine
I was
too.
trying to like
He keeps
shove him out
licking
of the
my
way this
feet.
whole time. He's
He's kissing
lonely.
my feet.
But there's the CMC certified care manager certified. And that is kind